Hi, this is Dr. Randy Bock. Today's March 23, 2022, and I am here for a conversation, viral conversation. We've been doing the coronavirus conversation week after week, um, and we've had some excellent guests. Last week, we had Tal Bachman. I recommend you go back and look at that. Um, we've had Jay Bhattacharya, and we've had Dr. Richard Ammerling, Dr. Nathi Mladla, from South Africa. So there's been some excellent shows. Um, and last year we had Brent Kiewit-Kyler. So I recommend you go look at some of our anthology. Today, though, I'm going to talk about a virus and about a vaccine, but not specifically coronavirus, COVID, except maybe peripherally. Um, I came up with the idea for today's show actually only today. So my research is I think it's there. It's not as potentially substantial as it could be, but I have had some previous thoughts on this topic, and the topic is shingles, the vaccine. Um, the it kind of gets pushed a lot, and I love vaccines. I love my vaccines, but I've always been a little bit skeptical about certain of them. Gardasil for one, and Shingrix or Shingrix for shingles the other. And I'll kind of take a pass on the Gardasil one for right now, but um, my wife was at the physician earlier today, or excuse me, yesterday, and she was pushed to get the shingles vaccine. And I know I've gotten this question over and over again from people, in the, as we age, the older cohort, um, to get, the shingles vaccine. And is this worthwhile? I'm kind of on the fence on it. Ostensibly, shingles is a very time limited episode. Um, People are familiar with getting herpes cold sores, and you can get them repeatedly. The herpes virus, you come into contact with, it gets on a mucosal membrane, and the virus travels. If it's a oral cold sore, it travels and it lives in the trigeminal ganglion, which is a nerve ending, kind of a nerve ganglion, kind of a nexus, and sits there somewhat inert and maybe covered by your immune system. And when your immune system is looking the other way, for instance, you have a cold, then the virion sees its opportunity, and in a sense, it kind of bungee jumps down the nerve root and has a kind of a party at your expense, and causes fever blisters, whatever you want to call it. And so there's type 1 herpes, which is generally oral, and type 2 herpes, which is the genital area, but there's a fair amount of interchange between the two. And especially, with sexual kind of mores and habits being what they are, there's reasonable transference from one place to the other. And I don't think the virion itself, the virus, knows which mucosal membrane it's on, whether it's a kind of a genital one or an oral one. And there are a lot of similarities between the two. So I'm not going to spend a lot of time on herpes and cold sores and so forth. Maybe we could do another episode. But the point is that chickenpox is a herpes virus as well. It's called herpes zoster virus, and shingles itself is called herpes zoster. And uh, so the original, what you get first is chickenpox, which is varicella virus, which is again a herpes type virus. And uh, most people these days don't get chickenpox because there's a vaccine against chickenpox. But many of us had it back before the chickenpox vaccine became as prominent perhaps as it is today. I don't think it has full penetration even now across the U.S. But I think it was, I'm not sure exactly when it was invented, but it kind of got into primary use in the 70s and into the mid 1980s. I think it achieved more prevalence in pediatrician's office and, being given. So I don't think people are getting chickenpox as much, but a lot of people, in the over 50 age group have had chickenpox, and they are at risk of having kind of a recrudescence, a re-emerging of the chickenpox herpes-like virus, and it'll pop up. In this case, it doesn't pop up along the facial nerve ganglion. It pops up along one of the spinal nerve ganglia, and it generally comes up as a rash along what we call one dermatome, which means skin slice, dermatome. Um, and it'll travel out, and it's on one side only, and it's along that nerve distribution. So the typical um, problem is a little bit like having a cold sore, but a bunch of them, or a little bit like having chicken pox, but just in one single band. I've seen a lot of them. Usually they're along the rib cage, but other places, and that's the most typical place to get them, kind of on the torso. Um, and so what? Well, you get this rash and it's painful a little bit, but there's the risk, since it lives on the nerve itself, of getting what's called a post-herpetic neuralgia. So post means after. Herpes actually is a Greek word for snake, which is what I think they thought the cold sores were, maybe a snake bite, or maybe they thought it slithered along the nerve root like a snake. I'm not sure how they came up with that name, but herpes is the same word as snake. And if you go, the part of the zoo that houses the snakes is the herpetarium. Anyway, maybe maybe they're not called that anymore. But so this herpes virus can come up again, and it cause a problem. So the post-herpetic neuralgia is such that, because the shingles comes up, it's almost like a burn in a sense. It comes up and it looks maybe as if you scalded your skin. You have some blisters and so forth, and along those lines. It can kind of make that nerve singe a little bit, and you'll have pain along that nerve distribution, potentially longer thereafter, months or maybe years, and potentially forever. So nobody wants to get post-herpetic neuralgia. And so the idea is you get the shingles vaccine to prevent a shingles episode, which is fairly time limited, usually lasts a couple of weeks. But again, moreover, to eliminate the post-herpetic neuralgia. Now, I just wanted to kind of go over the facts and figures of this problem and see if this is a worthwhile thing, and is it something that people need to do. My wife was told by her doctor, well, first of all, she was asked, did you ever have measles? Not chickenpox. And I asked her a couple times, you sure the doctor said measles? So maybe that's just a flub, and maybe my wife misheard it. I don't know. She's never been wrong before, so but the question should be, have you ever had chickenpox? Now, it's somewhat an irrelevancy, because theoretically you could have had chickenpox at a young age and not necessarily have known it, or your parents might not have transmitted the information adequately. You might have had it at a young age and they never brought it up. So you could have an immune titer to see if you've had chickenpox ever before. In which case, if it's positive, then you might think about getting the shingles vaccine, because you might have the possibility of its awakening. Again, often, I mean, for the most part, they don't awaken. I would say, people who have had chickenpox in their lifetimes, 2/3 of people will live their lives and not ever have shingles. And so they won't have this reawakening. It won't come back as chickenpox per se. It comes back as shingles. And people often ask, can you get chickenpox from somebody who has the shingles? Well, no, not really. I mean, yes, theoretically you could, I mean, it's kind of gross. You can turn off the sound if you want, but basically if you kind of licked somebody's shingles, you could maybe get chickenpox if you'd never had chickenpox before, you'd never had the varicella vaccine. So that's kind of an odd thing. It's a near impossibility. Chickenpox itself is respiratory, and you can get it from coughing and sneezing and so forth, and or touching the pox themselves. And that's pretty much how it's transmitted amongst kids, a little bit sloppier with their sneezes and so forth. But it's unlikely. I've never seen anybody get chickenpox from shingles. I've seen many, dozens, if not hundreds, of cases of shingles over the years in primary care practice medicine. People coming to see me for that. So the thing that I've always been a little bit hesitant about regarding the shot, the shingles vaccine, is, does the cost, I mean, any vaccine, any shot, any medication can give you side effects. There are potential side effects with the vaccine. The question is, do they outweigh the potential benefits of not getting shingles? And so the answer to every question on earth is it depends. And in this case, it partially depends on whether you are aware of having shingles. If you are aware of the shingles and you're aware of them very early on, you can get basically herpes medicine. A lot of people are familiar with Valtrex or Zovirax, which are versions of anti-herpes medication. And if you come to be aware of the shingles early on, you notice kind of a tingling and you see a band-like pattern of pain and so forth, and you're getting a few little bubbles coming up. They look like cold sores, except they're not on your lips or your genitals. And you start, you contact a physician, you start Valtrex early on, you will reduce the likelihood of getting post-herpetic neuralgia. And not everybody who gets shingles gets post-herpetic neuralgia anyway. But it appears from earlier studies that the Valtrex Zovirax family, the acyclovir family of antivirals are very effective in preventing post-herpetic neuralgia. They get rid of about half of the possibilities. I don't think that's so vastly different from what you can reduce with the vaccine. It could be, but there's some problems. We'll get to those in a little bit. So I have some slides I want to put up. Let's see if I can get things ready for you. And tonight's show is probably going to be clock in around half hour. I've got an affair to attend to tonight. So I just thought I'd pop this one up. And if you have other questions on COVID and whatnot, you can pass them along and put them in the query section. So let's see, that's not what I wanted to do. I wanted to maybe make it into a slideshow. These are shingles on a house. I don't know, I suppose I should look up how they came up with the term shingles for this illness, but I haven't done that yet. Maybe you could supply me with the answer if you don't mind. And this is from the CDC. Nearly 500,000 people over 60 years old oops, this is not good. Marshall, I have an audience here, and he was supposed to be quiet. Anyway, I apologize about that. It says nearly 1 out of 3 adults will get shingles in their lifetime. That means 2 out of 3 adults will not get shingles in their lifetime. 98% of adults have had chickenpox and are at risk for shingles. Well, this number will be changing over time, just so you know, because the fact of the matter is that as more people get the varicella vaccine, they will not have chickenpox, and they won't get chickenpox in the first place, and there won't be any live chickenpox within you in order to live and come back again, like one of these zombie movies or horror movies as shingles. So this is the case now, but this will change. I have another slide later that shows, kind of, I think it doesn't quite make sense. The CDC will be recommending the shingles vaccine for people who have had varicella vaccine to begin with. I don't know. I mean, this is the reason I kind of brought this up is there's some puzzling things about this whenever you kind of have the confluence of CDC and vaccine. They might think about just changing their name for the Center of Disease Control to the Center for Vaccine Promotion. I think there's a little bit of nonsense here, but be that as it may, I do think there's a role for Shingrix in the adult population, and that could be you. It might not be you. So these are some of the data regarding the rate of getting either zoster, which is then the actual band-like rash along your torso, and PHN, post-herpetic neuralgia. This is the more problematic thing, the nerve-like pain. So this is a problem that doesn't really happen amongst the youngsters. So if you get varicella at a young age and then you get your shingles, for the most part, we were taught in medical school originally that shingles is a one per customer affair, that you've had the chickenpox, you kind of it leaks out this one time as shingles, and then you don't really get it again. And there's probably a similar effect to the vaccine because, again, similar to COVID, if you've had COVID, the illness, you're not going to get COVID, the illness again. And if you give your immune system the exposure to the chickenpox virion in the form of the herpes zoster, shingles, then you're probably not going to get it again. The physician who saw my wife, and my wife has already had shingles a number of years ago, maybe 10, 15 years ago. And the physician told her that she's even more likely to get shingles again than the regular general population. I don't think that's the case. I think it would be the case if you had some coexisting other illness and something that might be immunocompromising you. This sounds familiar to COVID in a way. If the more comorbidities you have, and if you are immunocompromised, then you're in a different category of risk. And I think those people should be very ginger about their health care in general, and they probably should obviously consult with their own physicians. This is not intended to be medical advice across the board. This is just kind of looking into this issue, but I don't buy that per se. I think that there might be a risk of getting it again in your lifetime, but I would imagine if the vaccine works, then having the kind of the natural immunity come up from having the second episode of chickenpox would do the same thing and or better. So this is again, like many things, including COVID, this is a problem more in the elderly, and the numbers are not enormous. I'm not sure what this rate refers to, whether percent per year or something like that. But if it's one per three in your lifetime, as you go through these decades, I guess these numbers will add up to 33%. But they're heavily weighted in the older years. And like everything else, I mean, you're going to get something, and you're going to get a bunch of somethings as you get older. So the 70 or 80-year-old age group, this is something maybe to watch out for. I don't think there's much warrant in having a vaccine of this type before age 60, and age 60 is, lo and behold, the cutoff that the CDC recommends for beginning thinking about this. And they're also recommending a booster, and we'll get to that as well. So this is shingles incidence per 100,000 people. So this number here, 10 per 1,000 people. Sorry about that. This number here, if you get this high, this is 1% of the population. And so that's in the greater than 70-year age group, which coincides with what you might expect from the previous slide, this band up here. The 30 to 49-year-old age group is still getting apparently some shingles. I think this will peter out over time as the pervasiveness of people having been vaccinated kind of increases through the population. I think there's a countervailing factor, which is increased immigration. And some other countries, if you're coming from Mexico or El Salvador or whatnot, you may not have gotten your varicella vaccination 30 years ago. So you could be a 30-year-old, El Salvadorino living in the United States, and more likely to get recrudescence of chickenpox because you didn't get the vaccine and you had actual chickenpox when you were young. So if you factor out kind of native-born Americans who've had the varicella vaccine, this number I think will be going down over time. And I think the kind of the open window, the window of opportunity for Shingrix vaccine will diminish and be gone in a number of decades when the cohort of varicella vaccine penetration individuals reach this age group of risk, as it were. But they won't have the risk because they don't have the original varicella within them. So this is from a Canadian site from McMaster University. The bottom line, shingles is a painful condition. Anyone who's had chickenpox. And they're talking here about the live vaccine versus the attenuated, or excuse me, the new Shingrix. There was I can't remember the name of it. I think it was Novavax or something like that. That was against shingles, which was a live attenuated chickenpox-like vaccine. That one has been taken off the market in the United States. So there's only Shingrix, which is really just a recombinant fraction, kind of like the spike protein kind of thing. It's not the entire virus. So that's the only option here in the United States. In Canada, they might do the other one. So this is the thing I was pointing out. This is from the CDC. What if somebody did or did not receive varicella chickenpox vaccine or never had chickenpox? Do they still need shingles vaccine since the virus was never introduced in the system? It's like, so what does it say here? Individuals over 50, should receive Shingrix even if they previously received varicella vaccine. I don't know. I don't really get the sense of this. I think if you didn't have chickenpox and you have the varicella vaccine, I think that you're not really going to likely to get a rebirth of a virus that was never in your body and for which you had immunization to begin with. I could be wrong. I suppose there's a possibility that you don't have complete penetration of the chickenpox vaccine, and you might have had it. But I think if it's that mild, you were unaware of it, it's probably not going to be enough in your body to wake up later on. This is just to kind of show you in a sense, the minimal value of the Shingrix. This is on the left-hand side here is $QALY, which is the cost in dollars per quality adjusted life year. What is that? So that's in order to save a single year of life with this vaccine, you will basically have to spend hundreds of thousands of dollars across the board. Now, of course, if that's your 1 year of life, maybe there's no limit. But of course, in the real world, there's always going to be cost constraints and choices of how you want to spend your money. Maybe your money needs to be spent on a better water supply. Maybe your money needs to be spent on changing the grid, strengthening the electric grid, or giving better transportation, or cigarette prevention, or counseling against narcotic overdose. I mean, there's lots of different ways to spend the money. So if you're unitarily looking at herpes, shingles as being the sole vice, if this is the only problem of mankind, then you might have to look at this. But the value decreases over time because the vaccine itself decreases in usefulness over time. So there's some potential benefit for the first few years, and that tends to drop off over time. And the difference changes between these different age groups. There's 60, 70, and 80-year-old age group. And I'm going to just leave that here. If you want to puzzle over that, you can. It's not the most obvious thing in the world. This one is even less obvious. I'm having trouble kind of pondering this, and I'm going to maybe come back to it at a later date. I don't want to have my ignorance show too heavily here. But on the left axis, we have the probability of being cost effective. And these are different age groups, 60, 70, and 80 and above over here. So the 60, we'll just look at the 60-year-old. And this is with a booster in the circles and triangles, excuse me, boosters, with the circles and triangles with no booster. And so the willingness to pay, the amount of money you're willing to spend to save a quality adjusted single life year, if you're willing to spend more and more, then let's see, the probability of it being effective actually decreases over time. So I think what they're showing is that there's a if you have a booster at 10 years, then your money will have been better spent overall in prolonging that cost effectiveness. But I'm willing to be educated or re-educated on this topic. So if you have a better insight on this, let me know. This is from a Korean study, which is listed over here in the bottom. And this is the cumulative recurrence rate of herpes zoster. This is if you had it once, you've kissed me once, will you kiss me again? It was an old commercial from breath mints or something like that. And the question is, if you had it once, will you get it again? And they keep adding lines here, and you can look at the bottom to see what these are related, but we'll just look at the top chart over here. As time goes on, you have perhaps a distinct risk of getting a second case of it, but it kind of maxes out at about 10%. And since most of your cases, we go back to some of our earlier slides here. Let's go back to the beginning. Since most of your cases are up in this realm, if you have maybe a 10% chance of getting it again, you're already 90 or 75 or 80 years old. You're kind of at the end of life anyway. So this is again not the most common illness per year, and the likelihood of you're getting it again, I don't think is that great. As far as my wife's physician, maybe there are some studies that show if you get it once, you're more likely to get it again than general population, because perhaps, let's say you're immunocompromised to begin with, so you get your first case and you're still immunocompromised 5 years from then, so you get a second case. But I think in the general healthy population, you are much less likely to get a second case than somebody is to get a first case. So this goes to my earlier point about, instead of, totally avoiding the vaccine, what if you just wait till you get it and you take this case oral acyclovir. There's also valcyclovir, which is a better version of Zovirax, which is Valtrex. And here's on the bottom the conclusion: the treatment of herpes zoster with 800 milligrams per day of Zovirax within 72 hours, so early on, may reduce the incidence of residual pain, that's herpes post-herpetic neuralgia, at 6 months by 46% in immunocompetent adults. So you're not immunocompromised, you're an adult with an intact immune system, you're going to reduce your incidence, the likelihood of you getting post-herpetic neuralgia. Now, this may not be quite as good as the Shingrix itself, but again, if we go back to the earlier slide here, the actual odds of you getting post-herpetic neuralgia are pretty low if you're young and healthy, and it increases to maybe 3% and so forth per year if you're in the older age group. So I don't want to lay it on the elderly, because God knows I'll be there soon enough if things work out. But it's a consideration. Personally, I will confide in you that I have not had the Shingrix vaccine myself. It's something to ponder. I've not had herpes zoster yet, but I feel fairly confident that I would know when it happens, and that I would take the Valtrex early enough on and adequate doses to avoid post-herpetic neuralgia. In my own experience of treating people, I had people come in all the time, and I gave them a good healthy dose of the Valtrex, and I never had a complaint of post-herpetic neuralgia. That's not science, that's anecdote, but that's from my own cohort of maybe doing this with 70 or 80 different episodes, maybe more over the years. And I didn't really get any complaints of post-herpetic neuralgia with treatment of Valtrex. This is a separate issue. The CDC says some people shouldn't get the shingles vaccine. I'm going to just leave this list here. If you're pregnant, breastfeeding, you currently have shingles, and here they say you tested negative for varicella zoster virus. So that's a little bit contradictory what we saw also from the CDC, and I'm just going to leave this list here. So if you're currently ill, I guess. But then the other question is, should you not get it for other reasons? And again, as the as the older people age out and disappear, and the younger people become the old people, I think this will become a little bit of a, as they say, a moot point. My dog has to leave now, so hopefully there's no more barking, surprise barking. I apologize for that. And so you can see the penetration of the varicella vaccine, and this likely will increase over time. Is that all I have for slides? Let's see. Yeah, I think that might be it for the slides. So let me just back out of this. I'm going to remove this. And now you get a lot of me. Anyway, so what are the conclusions here? Again, this is not a medical advice column or podcast or videocast or whatever you want to call it. So I think you have to make your own decision about this kind of thing. I imagine most of my audience hasn't reached 60 years old, but those of you who have, you can consider this and discuss it with your physician and make your own decision. I think, frankly, if you're reasonably attentive about observing if and when you get a shingles case that kind of have this banded rash, so forth, and you get the treatment early on, I think your risk of getting post-herpetic neuralgia is fairly low. But be that as it may, there are side effects from it. I guess I didn't post this, but like anything else, let me see if I can. Oops, I closed the window. I apologize. Anyway, I was going to pull up. Why can't I see this? Oh, here we go. So there is a window here. I have, like anything else, there's a lawsuit. So let me see if I can find this. So this is, I'm not going to, I'm not endorsing this. I don't know the extent to which there are side effects. But like anything else, you can go to the VAERS, the Vaccine Adverse Event Reaction System, or something like that, whatever the response system that the CDC has, and you can go click in and put in shingles or Shingrix and whatever. But there is naturally a site devoted to getting yours if you've had problems with it, and so obviously there's some lawsuits. I guess the previous one was Zostavax. That's the one, the name I didn't get correct earlier on. That was the Zoster Vaccine Live, ZVL. Currently, there's a not live, it's just a fractional piece of protein, Shingrix. So that presumably there won't be the same level of side effects as there had been with the Zostavax. So I think that might be it for me today. I hope that was on some level helpful and interesting to you. And if it's not, well, let me know. If you have other topics you'd like to hear about, just give me a buzz. We're going to probably get back to some, kind of mopping up coronavirus issues. Although, there's a lot to be said about that. I mean, every day I see something weird and bizarre in the COVID world. I was playing tennis earlier today, and it's a big tennis pavilion, enormous. I don't know what they are, 40-foot ceilings. And a young girl was taking a lesson a few courts down, and she's probably 15 to 18, and she's got a mask on. She's playing like that, taking her lesson first 20 minutes with a mask, and then mysteriously the mask disappears, and I guess the virus is no longer scared of her, or vice versa, and she finished like the next 40 minutes of her lesson without a mask. So there you have it. I'm going to call it a day, and I look forward to